everybody. Thank you for having us. Today, we're going to start by sharing with you about an Indigenous community-led approach to cultural safety education that seeks to decolonize the healthcare system through making and through dialogue. And this is a 3-year collaboration between Emily Carr University of Art and Design and the College of New Caledonia. Next slide, Nadia. Yeah. We don't have much to disclose, but we want to acknowledge with gratitude that this project is funded by the Vancouver Foundation through a systems change grant. One of the unique aspects of the work that we're going to speak to you about today is that it's an approach to cultural safety education for healthcare students and practitioners, but it emerges from the work of an Indigenous-led team and a team of designers at Emily Carr University, working in close collaboration with the College of New Caledonia and Marlene Erickson. And so on that note, we want to start by introducing some of the members of our team. We have about 15, 16 people on our team, and some of which are here today. But Marlene is really at the core of the team, so we'll let her introduce herself first.
Marlene Erickson, Executive Director of College of New Caledonia. I'm Nakazaliwatan and the Soyu, the Frog Clan. And thank you for all attending today. And sorry, I'm totally blanking. Sorry, I'm zooming in from the territory of the Lheidli T'enneh. And I also need to acknowledge the team at the college. The Health Sciences Department has been helping us to recruit students to participate in the workshops.
Well, my name is Brenda Crabtree. My Halkamilam name is Hiathalamut, and it translates to She Takes Care of Others. I am a member of the Spasm Band in the Fraser Canyon. I'm also the Director of Aboriginal Programs and Special Advisor to the President on Indigenous initiatives. And I am grateful for the relationship and connection between Emily Carr University and the northern rural community of Prince George for over 20 years.
Hello, my name's Connie Watts. I'm the Associate Director, Aboriginal Programs at Emily Carr University. I'm Nuchanath Gitsan and Kwakwakiwak. I bring my art and design skills into the planning and execution of this project.
Hi, my name is Nadia Bezai, and I'm the coordinator at the Health Design Lab at Emily Carr University. I'm an immigrant to Canada with South Asian and Middle Eastern ancestry.
And I'm Kaylee Raber. I'm the director of the Health Design Lab at Emily Carr University and a settler of Eastern European descent, working and living on Musqueam, Squamish, and Tsleil-Waututh territory, along with the rest of the Emily Carr team. Our team started this work more than 3 years ago with an idea about how arts and material practice can foster cultural safety. And the purpose of these workshops has really been further validated by the recent In Plain Sight report, which Brenda will speak about.
As noted in the recent report, In Plain Sight, current education and training programs are inadequate to address Indigenous specific racism in healthcare. Clearly, something is lacking, and we need to extend the learning to include the pillars of cultural competency. But more importantly, we have to recognize the limitations of classroom clinical practice in teaching these pillars. And we need to find methods, and we need to find methods to move healthcare providers to a place where they integrate them into their practice. We need culturally relevant strategies and learning tools to improve cultural safety within healthcare. Also, as noted in the Plain Sight report, there is no consistently mandated training for healthcare staff on Indigenous cultural safety, Indigenous specific healthcare, and Indigenous specific racism, despite the commitment being made by the province 14 years ago in the Transformative Change Accord, First Nations Health Plan. Similarly, there is no mandatory content threaded across professional programs. There is a significant demand for training amongst healthcare workers and organizations. Indigenous healthcare statistics continue to highlight marginalization, inequities, and disparity in healthcare for Indigenous peoples.
We're briefly going to go over our workshop approach. We're running a 3-day workshop series as part of a larger initiative to improve Indigenous people's experiences in the BC healthcare system through a material practice-based approach to cultural safety education. These workshops are Indigenous-led and use arts and material practice to facilitate dialogue, relationship building, and knowledge sharing between the Indigenous community and healthcare professionals and students in some cases, a mode of gathering that creates space for conversations. Our overall goal is to shift how the next generation of health professionals view Indigenous health and support an environment where Indigenous people consistently access culturally safe and appropriate care, feel comfortable using our healthcare system, and experience health outcomes in a better way. In our first workshop, an example of conversations that came up where inequities Indigenous people were prevalent was one participant said, preparing to be believed is hard work and needing to figure out how to behave to be believed and perceived of worthy of care and respect is not something anyone should have to do. For this pilot phase of the project, we've been working with a range of First Nations communities in and around the Lheidli-T'enneh region to build capacity locally. We've been leading on Darlene McIntosh, a local elder, Marlene and Jessica Erickson on our project team, and have been guided by their local protocols as well as local artists as material practice knowledge holders in a range of kind of making activities like moose hair tufting and quill work. Our first workshop was held last spring in Prince George, pre-COVID, and our whole Emily Carr team kind of went up to join our Prince George team in person as participants, not just as researchers and material practice instructors, as a, at the periphery of the project. So that was quite important. These workshops are about creating a collaborative, collective space, bringing two groups together to address very difficult and painful issues, rather than focusing on blame. We acknowledge that each participant brings value, knowledge, and a unique perspective to the conversation, and we give voice to all participants and recognize it is our collective knowledge and efforts that we can move towards a better future.
There is great value in making. It opens up your creativity, which in turn opens your ears, eyes, and heart to create safe space. The diversity of material allowed for individuals to find connection. Not all materials connect to every person. The projects are not meant to be completed in the workshop. They're meant to connect with making and with each other and in conversation. Materials have a life unto themselves. Take, for example, the drum is a constant reminder of our responsibility towards the preservation and health of Mother Earth. Making created a safe space for conversation. During many seminars, people listen and then go away. They don't know how to talk about it. The making and sharing circles created the safe space for people to talk, learn, and process it. It created a community of understanding, compassion, and strength.
So we've run one workshop so far and are running 2 more virtually in the coming months. Our team has been developing this work over the past 2 years, taking a very slow and intentional approach to the work. And through this time and process of development, we've learned a lot about relationships between Indigenous and non-Indigenous members of our team, relationships between participants within the workshops, relationships between education and the community, and relationships between Indigenous people and the healthcare system.
We continually defer to local communities and their cultural leadership. We're guided by these local communities with their local artists and team members, their elders, their stories, and their protocols. If this workshop was held in a different community, it would look very different. We take a very organic, grassroots, local approach.
Oops.
One of the things that I think our team has really learned about and reflected on throughout the project too is sort of learning about relationships between Indigenous and non-Indigenous participants in the workshop, but also understanding and thinking about how that interplay works as well within our team. We have a really diverse team of people, including Indigenous leaders and artists, as well as non-Indigenous designers. We have a physician on the team and the community planner. And so we've learned sort of how to really take time in building trust and figuring out how to work together, and how that really requires ongoing conversation. And we've also had to really consider our roles and how that, and talking about how we can be researchers and we can be facilitators and we can be participants. And it's okay to sort of blur those boundaries in a way that sort of, I think often in academia, we feel that we cannot. And the project has also really asked us to confront and to really realize the colonial institutional processes within our organizations and within academia. And so it's both sort of through the workshops themselves and through the process of creating the workshops, we've had a lot of really important conversations and are really sort of continuing on our learning journey. Our team is about to shift to running these workshops virtually. And so this is really asking us to consider how do we maintain the integrity of sort of community, of dialogue and relationship building within this format. And as we sort of continue learning with our own work, we sort of, through this presentation, want to encourage you to consider how relationships play a role in the work that you're doing. Marlene, do you want to sort of conclude?
Yeah, in conclusion, we're very excited about positive outcomes of this way of teaching. It demonstrates how building relationships is foundational to changing attitudes. And this is not being achieved in a lot of classrooms. Further, it draws on local knowledge holders, and so there's no shortage of expertise. Cultural competency, or as our elders call it, gentle hands, is a critical component of improving the health outcomes of Indigenous peoples, probably as important as the medical knowledge that students gain. And we hope workshops like this one will instill those skills so the participants will carry them into their professional practice and beyond. Nina, Chafia, we thank all of you.
We've got a few questions in the Q&A box here. So I'm happy to read them out if that's okay. So one question was, how can we participate in these workshops?
I can answer this for right now. Yeah, right now we're doing it with students at the College of New Caledonia. And so we're kind of doing it as a pilot phase to see how we can integrate it, you know, at a kind of student level, at a community level, to kind of see how this process could kind of work in that setting in a local community where we're following their protocols, and then, you know, slowly expanding and seeing if other people could be interested, or we could scale this in, you know, for other people as well.
Yeah, so right now there's, you know, no opportunity for sort of the general public to join, but we're definitely interested in looking at how we can sort of scale this pilot and do it in other organizations, and are happy to speak to people individually about that. I can see the chat, so I can keep going if you want. I see that one of the questions is about it being offered virtually and how are we doing that. So we haven't done it yet. We're gearing up to do it in a month. And if you could go into Brenda and Connie's studio at school right now, you would see the amazing kits that they have put together. I think we have over 50 kits that we're sending up to Prince George. Do you want to speak to that?
Yeah, in addition to compiling, and it was in the slide 19, I think, that showed the amazing variety of materials, everything from drum kits to rattle kits, porcupine quills, moose hair tufting. We again take the local approach, where Marlene, our lead at the College of New Caledonia, is getting local artists to actually facilitate the virtual workshops. We at Emily Carr in our Aboriginal Gathering Place are providing additional support, because we are also instructors and material practitioners and artists. And so we're busy. We're going to be shipping all these materials out to the participants. In addition to that, Emily Carr Aboriginal Gathering Place has an amazing site, and please check it out if you're at all interested in working with traditional materials. with teaching videos on everything from beadwork to moose hair tufting to drum making, including resource connections and handouts and everything else. So thank you.
I see that one of the other questions in the chat was about how do we get providers to commit to taking the time off work. So right now our approach has been actually to work with health science students from CNC. So we have a group of dental hygiene students and nursing students, and I think a range of other students who are joining us. And that's really been in large part with the help of Marlene and the Dean of Health Sciences. I don't know if Marlene, do you want to add anything to that?
Sure. If the deans and the coordinators are working right now to try to work them into the students' preceptorship hours, our internship hours in some cases. So we have like 8 health science programs, and so they're working really hard to try to make it part of the curriculum, and so the students can get credit for it that way.
Another thing we're trying to do is do it over kind of a Friday evening to Sunday model this time, to allow for kind of, people to do it in a weekend capacity in between their programs that they have or classes that they have.
I think it's really important too about drawing on the local community expertise, because then it leaves the opportunity for the students to have a continued connection and relationship with the people that they meet in these workshops. Because often, we'll kite, a guest speaker into a classroom, and there's no opportunity, right, to talk further or have a relationship. So these kinds of workshops are really important in building relationship.
Kelly, there's a question in the chat that says, I'm curious if you're going to publish your process and outcomes.
Thank you, Connie. I was actually just looking for the link. We do have one paper that was recently published that speaks about this project and part of another project. So I can put that in the chat here. I think this link is going to take you to like a whole set of conference proceedings, but if you look in the table of contents by Brenda Crabtree's name, you should be able to find it there.
And I really like the other comments that we got. This would be a wonderful program for children and families who spend many days in hospitals. And thank you so much for the hard work and innovative approach. This sounds like a great workshop, and I'm looking forward to the day when we can have a chance to participate and learn. So are we. Totally. Thank you.
Thank you so much. And we're right on time. Thanks for all your questions to the participants, and thanks so much to the speakers. This is sounds like a wonderful initiative, and one that many of us can learn from in terms of our own learning journey around cultural safety and humility. So I'm going to turn it over to the last presentation.